All right. So, hello to all dear students. This is Dr. Rahul Rajeev, your medicine faculty at Doc Tutorials. So, welcome all of you to this session where the faculties of Doc Tutorials will be addressing a very important question on how to approach final MBBS. So, many of you have just come to your final MBBS, and I'm sure that you will be having questions because from your seniors, you would have heard you've got medicine, surgery, OBG, pediatrics, lots to study. So you would be having questions on how to approach each subject. So we are trying to guide you here. This will not be a lengthy session. We will try to keep it very concise, crisp, and to the point so that you get benefited by this session. With me, I have a panel of eminent faculties who are the leading faculties of their own subjects in the country. And I'm happy to be with them. First of all, the doyen of surgery in our country, Dr. Rajamahendran sir, who's a very passionate surgeon and a teacher who loves teaching. He's a practicing surgeon. So welcome, sir, to this session. And then we have...
Very, very nice to see you all, sir. Because the final year entire next team is here. Because all the students are very much scared about the next, which is going to come from December 2023 as per their schedule. We don't know whether it is going to come or not, but always Dr. Tutorials takes a one step forward before any other platforms takes into account. So for final MBBS students, I'm just going to give brief review of how to prepare for surgery in your final MBBS. So many pre-final year students in Tamil Nadu are still undergoing exam. Hope they will be seeing this video once they enter into the final year from next month. And many universities already final year started. So final MBBS is a crucial period for a medico. For any medico, final MBBS is a crucial period because this year what you are going to learn is what you are going to practice for your lifetime. Very important. Though I am a surgeon now, I still see some gynec cases, some pediatric cases, some medicine cases coming to me, and I have to identify them during the surgical aspects and I have to refer them to the concerned specialist. So having a basic knowledge of medicine, surgery, OG, and pediatrics is very must for any MBBS student. So when you are reading for surgery, when I tell this, most of them will not accept because all of them think there are so many Indian author books. This book is very difficult to read. The Bible of surgery, when you are going to read this book, Bailey and Love, you will never hate surgery at any point of time. Everybody who had interest in becoming a physician or become a surgeon after reading this book. That much, it is an extraordinary book. It is not Bailey and Love. It will make you love surgery. Such an extraordinary book. You have to go through this book. No other way. It is 1,500 pages. Yes, accepted. It is little difficult. Everything is accepted. But no other way. You have to undergo fast revision and fast reading of this book. And in Doc Tutorials, we have complete videos of the subject based on this book alone. So I request you, friends, please go through Bailey and Love skin to skin if possible, because you have a lot of time in final year. You are going to read only 4 main subjects. You have enough time to read Bailey and Love. So when you read Bailey and Love, it covers clinical aspects also. It covers the clinical aspects. It covers theoretical aspects. It covers what to be not done, what to be done. Everything is covered in this book. So very important is Bailey and Love. Yes, there are so many other books, Manipal, SRB. Every book is good, but most important, Bailey and Love. What is given in Bailey and Love is not there in any other book. You can understand what I'm telling when you read the book only. So theoretically, you have to read Bailey and Love. All the next syllabus which is made by the NMC is based on Bailey and Love. Each and every chapter of Bailey and Love, they made as curriculum SCU1, SCU2, SC3 is nothing but Bailey and Love index. It is the index of Bailey and Love they made as surgical curriculum. So I request you, please go through Bailey, very important for your exams. And for clinical aspects, you have to undergo some important books like short case DAS or clinical case DAS. And you can also use my long cases and short cases book. I have given brief outline. But at present, you should know the clinical cases, we don't know whether it will be there or not. So whether it will be there or not, we don't know because practical exam, will it be there in next? We are not sure. If practical exam is there, definitely the clinical books will be helpful. If practical exam is not there, definitely the next pattern of questions we are coming up in Doc Tutorials. We are going to make all the next pattern questions It will be available in doctor tutorials as video, as well as test and discussion will be also available. So you should use those videos in your exam. So I request you, please go through Bailey. Bailey has been made as a NMC curriculum. It is not by anybody else. NMC has made the curriculum of Bailey-based curriculum. It is not surgery based on any competency base. It is purely based on Bailey and Love. So one book is enough for your final year for reading complete surgery, including theory, next pattern question, clinical, everything is covered in Bailey. And in doctor tutorials, we are coming up with extraordinary videos completely based on Bailey and Love only. So definitely you must utilize doctor tutorial videos. So this is up to surgery, sir, because I don't want to take more of their time, because all subjects want to discuss. So you can go on with the other subjects, sir. Thank you.
So for the students, the essence of what Rajamahendran sir said is the core of surgery is there in the Bailey textbook, and all of sir's lectures is based on Bailey. Let me just add one more point. When you watch sir's lectures, you will also get to know about many surgical methods from his own practice. If you watch his lectures, you will see cases that he has operated upon. Now, this you cannot just get by reading any textbook alone. So I think you can definitely make use of that. It will be like as if you are in the theater and somebody is teaching you, okay, this is what I'm doing. So that sort of surgical handholding, that also you can get with sir's lectures in the app. Right. So next, we'll move on to the second subject, obstetrics and gynecology. Ma'am, with the next coming up, OBG is a separate group and will definitely have a good weightage as well. So ma'am, as a student, moving on to obstetrics and gynecology, how to handle this subject? What advice will you give to a final MBBS student?
Good evening, students. I'm very happy that I'm a part of this eminent team. As Rajamahendran sir rightly said, there is always a standard textbook, a Bible for each and every subject. So likewise, we also have a Bible for OBG, which is nothing but Williams Obstetrics and Williams Gynecology. So what I would suggest for students is, see, first of all, you have to decide on which textbook you're going to follow. You have to stick to one textbook as much as possible. And you can always have supplementary textbooks for references and to add on a few points to the main textbook that you're going to follow. This is one thing. Secondly, when it comes to OBG, as you all know, OBG, most of you consider OBG as a very toxic subject. You think OBG is, a very tough or, a terrifying department or toxic department. But one important thing about OBG is that OBG is easy to read when compared to medicine and surgery, with equal number of questions, and is a very much doable and a scorable subject. So that's one important aspect of OBG. So what I would say is there are certain things that you have to learn from the clinics and there are certain other things which you have to read from textbooks. So what all should you read from your clinics, learn from your clinics? See, there are few topics in obstetrics which are to be learned in the wards, especially in the labor room. Okay, so those topics are like, say, stages of labor, partogram, pelvis, skull, and NST, non-stress test, CTG, and PPH, postpartum hemorrhage, and drugs, various drugs like oxytocin, carbetocin, methogen, carboprost. See, all these are topics which you have to learn from the clinics. Okay, so it's very, very important that you attend your labor ward postings in the final years, see patients and examine the patients, learn the Leopold maneuvers, learn how they manage, labor, see how they're plotting the partogram, see various sheets of partogram, and see the NST images so that you get more and more of knowledge on how to manage a patient in labor. Okay, so we in doctor tutorials have videos on each of these topics where we have discussed extensively on how to plot a partogram, how to read an NST, how to trace the fetal heart rate, what all complications you can expect. And now you all know that we get more and more of image-based questions in the NEET exam as well as in the upcoming next exam. We expect the same pattern. We can always expect questions, image-based questions on partogram, on NST, on different maneuvers that we use on a pregnant patient, which you all have to learn from the clinics as well as from the doctor tutorials app on the corresponding topics. So other than this, Now, if you have to learn few important theory topics, which we usually don't learn in our clinics, like say the fundamentals of reproduction, or amniotic fluid, or the placenta, like those theory topics, we have extensively covered those topics in the Doctor Tutorials app. So I would strongly recommend and suggest you all to watch those videos and learn and prepare notes from the app. Okay, so once you watch a video on the Doctor Tutorials app, what you do is you prepare notes with your own handwriting, and keep the notes for future references. And apart from this, the one textbook that I would recommend for you all is definitely Williams Obstetrics and Williams Gynecology. So as you all know, Williams Obstetrics is the Bible for obstetrics, and Williams Gynecology is the Bible for gynecology. Okay, so as Rajamahendran sir told, how Bailey and Love is the most important book for surgery, and how questions are taken directly from word to word, line to line from Bailey and Love. The same way for the NEET exam, or for the upcoming next exam, questions will be directly taken from obstetrics, Williams Obstetrics and Williams Gynecology. So the one book that is the most important for your next preparation, or for your prof exams preparation, will be Williams Obstetrics and Gynecology. So if you see the videos on Doctor Tutorials app, you will understand that each and every topic, each and every point is directly taken from Williams Obstetrics latest edition, and we have put it in a very concise way for you to learn the subject easily. So what I suggest is, after you finish watching each and every video, make sure you make a notes and have it for your pre-exam revision purpose. Okay, so this is about how to prepare yourself for the prof exams and the next pattern exams. So thank you, dear students, for giving me this opportunity to address on how to prepare for the NEET exam or the upcoming next exam. Thank you, sir.
So thank you so much, ma'am. And students, if you have noticed, Rajamahendran sir and Vidhya ma'am, both were also emphasizing the importance of being present in the wards as well. The clinical aspect is very important. So remember, when you are in final year, my advice to you also will be, please attend your ward postings, and you can use the resources like our video lectures, which will guide you. Okay, because remember, at the end of the day, we are here to become good doctors, better doctors. So it's very important for all of you to be punctual in the wards. In the surgical specialties, you have to be in the wards, the theaters, see, observe, have doubts, discuss with your faculties. You can ask all of us, because the Doctor Tutorials faculties, all of us are having our own social media, Telegram groups. So you can ask us doubts as well. We are always there to help you as well. And I think thereby it's an evolution. As final year progresses, you gain knowledge, you gain clinical skills. And I think you also feel happy becoming a doctor on learning new things in final year. I think final year is probably for me one of the exciting phases of the MBBS training. So talking about training, one of the country's leading pediatricians who has been trained in the probably the best pediatrics department in the country, Dr. Sandeep sir. So Sandeep sir will be guiding you on how to approach pediatrics as a subject for final year. Thanks a lot, sir, for joining. Your thoughts on this?
Thank you, Dr. Rahul. Good evening, everyone, and a very good evening to all the students who are listening to this live session. Some of you will be listening to it after it goes up on the YouTube also. So if you're a final year student, coming to my subject, there are a few takeaways that you need to understand. First thing, a child is not a miniature adult, right? Remember this. Otherwise, it would not be a separate subject. Second thing, pediatrics is like a stepchild in every medical college. Everyone reads medicine a lot, surgery a lot, gynae a lot. When it comes to pediatrics, the energy simply dissipates away. You need to understand that pediatrics is a proper subject. Secondly, it is a scoring subject. And thirdly, it is not as vast as medicine. So if you pay proper attention and your topic coverage, your logics, your concepts in the topic, they are good enough, you have a stronger likelihood of scoring very well in your exam. We all know that next is just knocking on our doors, and there is a good probability many of you will be sitting for the next exam. As per the current draft, it may be changed later, but the current draft says you will have to clear all these individual 6 subjects individually. So even if you are very good in, say, a subject like ENT or in medicine, you can, and you're bad in surgery and in pediatrics, you are still going to face a lot of trouble. So this is one thing that you have to pay enough attention to your subjects, number one. Number two, what are the books you should be focusing on? Unlike other subjects, OP Ghai, 9th edition, that is more than enough. It is likely that 10th edition will be coming in a few weeks from now. But till now, whatever book that you have, the Indian textbook OP Ghai, more than enough. Just stick to that book along with the practical manual, which is being followed at your medical college. In most of the places, it is your Meherban Singh. At some places, it is Aruchami or Santosh Kumar. You can follow that particular book. No other book is needed. As far as Nelson is concerned, yes, for some difficult exams, for some difficult questions like they are asked in NEET, PG or INI-CET, certain things from Nelson are asked. But you need to understand that Nelson is as bulky as Harrison, and its weightage is not as much as medicine. So you should not be wasting too much of time trying to read Nelson in your final year. What I have done, what I do in my lectures is I try to incorporate the relevant points from Nelson. In addition, whatever you are reading, please read, keep reading your core textbook. End of the day, Rajamahendran sir rightly said, the only book you need to read is probably Bailey in surgery and OP Ghai in pediatrics. Keep adding it with MCQs, keep building up your logics, your concepts, and I think you will, once you look back 1 year later, you will feel that you did the right thing, not, running helter-skelter or running random reference books. Reference books are not needed to crack and get even rank 1. Yes, you can get rank 1 in any entrance exam. At least in pediatrics, you can get a 100% score strike rate without going for any reference book. Keep that in mind. Second thing, yes, Dr. Rahul very rightly said, you should attend the clinics. In fact, if you look at the questions which are being asked, in recent INI-CET, there was a question that a newborn is going to be cannulated, and what are the things that you are going to use? No teacher, no platform is going to teach you that. This is something you will learn in internship, and even when you are attending your bedsides, you can simply, observe and see what is the part in a newborn where you are applying a pulse oximeter. That is an MCQ. This is not something which can be taught in a class. What are the things you will be using, whether a 2 ml syringe you will be using or a 5 ml syringe you will be using while flushing a cannula. These are the things which have been asked in the recent exam. And for that, attending the clinics, even if you're not going to actually do a procedure, just watching that procedure, coming back, reading from the book, and if you have a doubt, asking us, I think that much is good enough. Don't fall in for FOMO, don't fall in for one-liner or the so-called revision sessions. As of now, in final year, focus on building your core. If your foundation is good, the building is going to be very stable. Whether it is NEET PG or next exam, you're going to do wonderfully well. That is my take on my subject, that is pediatrics. But obviously, you will be interested in knowing what to do in the vast ocean called medicine. So, Dr. Rahul, can you please enlighten the students how to go about medicine? Because medicine is like, as I said, it's like an ocean.
Yeah. So I think, see, this vast subject of medicine, as sir said, I think if you go systematically, you are in a better position to understand the subject and also to face exams like next confidently. So let me just share my views on this. First of all, a subject like medicine, I think the learning starts from the bedside. Let's say I see a case of pleural effusion in the wards. Now, this is your exposure to a very important case of pleural effusion. You just talk with the patient, understand his symptoms, why has he come, and you take a good history. You have to know how to analyze the symptoms, and then you see how the case has been worked upon by the consultant as well. Now, after that, please come back, open the app, watch the video lecture of pleural effusion. Now, I'll say that before you open a textbook, obviously standard textbook you have to follow, but I would suggest, see, considering the amount of subjects that you have, especially with the next coming in, the smarter way will be first open the app, watch the video lecture on pleural effusion, get a basic idea, because see, as a clinician, when I teach a subject or a topic like pleural effusion, my reference will be Harrison and also other standard textbooks. And along with that, see, I am a practicing doctor. So whatever cases we see in routine practice, what is the latest guidelines, all this will be incorporated in the lecture. So once you watch the lecture, you will get a wholesome idea on the topic of pleural effusion. Now what you can do is, you can either make your own notes, which is the best, or rely on the soft copy notes in the app. There is also a provision for getting hard copy notes. And then I would say that retrospectively, just go through Harrison. Now, this will also give you a confidence, because otherwise, if you start with Harrison, I think it is going to take more time. So that might not be the best idea. So you just go back then from the lectures to Harrison, and then you feel good. Okay, sir has already taught this. I know this, and you are in a better position. So this is very important. Point number one, this is a sequence. And the second point I want to stress, which I think all the faculties will also agree, along with doing a particular module in the app, please practice MCQs. Especially in the Doc Tutorials app, we have got a very exhaustive question bank, but again, we have not just tried adding questions. Majority are clinically relevant questions based on the next pattern. You practice the question. You watch that particular video lecture on respiratory system, you practice MCQs. Then it will give you an idea. Okay, this is where, I have to just work once again. Let me go back to my notes. It will help you again. So please do MCQ practice. Now, next point is when you actually study a subject like medicine, I would suggest that you just revise periodically as well. Else you might forget not only medicine, even other subjects as well. And next, I would like to say that when you study medicine, always make sure that the clinical-oriented subjects clinical-oriented topics, the preclinical and the first-year subjects, do not overemphasize on them. Because suppose many students ask me this question, sir, I am in final MBBS, my basics in physiology, it's very weak. Shall I go back and watch entire physiology lectures? Well, considering the amount of topics you have to cover, I don't think it is advised. What you can do is, even if you watch a simple module of mine on jugular venous pulse, say JVP, the essential basic physiology I would have discussed. Same is the case with Rajamahendran sir, Vidhya ma'am or Sandeep sir. The relevant basics they would have discussed. Correct, sir?
Correct, sir. We always start with
definitely, sir.
Points is definitely there.
But you always have the provision of listening to the other subjects as well by going through the integrated discussion videos in Doc Tutorials. If you look at the integrated discussion videos, say I am having a discussion video with Nilesh sir. So we both are discussing a clinical scenario of a diabetic patient who presents with hypertension. In that video, if you watch, sir has discussed regarding the list of antihypertensive in brief, and I have discussed upon the approach to treat hypertension. Now, what is the advantage? In a short time frame, you are covering both aspects. This will boost your confidence as well. I will strongly advise all of you to go through those integrated discussion videos. All our wonderful first-year faculties, second-year faculties, they have done so many videos, and we'll be coming up with more such videos. We are planning to add more videos as well. So do not miss on the integrated discussion videos. This is again very, very important. So from the medicine point of view, these are the points I want to highlight. Just to summarize, start from the watch. Second, video lectures first, self-made notes best, then retrospectively go to Harrison. MCQ practice to gain confidence in the first year and second year subjects, just go through the integrated discussion videos as well. This is what I want to tell about medicine as a subject. In between that, periodically revise as well. And from what all of us have spoken so far, Rajamahendran sir, I have a question for you.
Yeah, please,
So
sir.
if because all of us have said that our own subjects are vast. Okay. So as a final year student, can I rely on capsule courses, a capsule course of surgery? I'm just entering surgery. I don't want to read too much medicine, surgery. So all those rapid capsule courses.
Your answer is there on my desktop, sir. I don't know whether you could see this or not. 1 second, I will make it unblurred.
Yeah.
This is very important thing usually I have on my desktop. This is the desktop.
No shortcuts.
No shortcut, work for it. This is
right.
mouse actually. This is the mouse keyboard. I always have this. There is no shortcut for work for it. You may take some extra time, but if you work it in a straightforward, decent way, definitely the speed will be automatically increasing. So some people may think, how can I finish surgery in 3 months? How can I finish Bailey in 3 months? There is one short course available. Short course of surgery is available within 10 days. I can finish. Please remember, shortcuts are not there for success. You have to read Bailey. When you read Bailey and grasp the points, you can make your own shortcut. Make notes, as sir told. Sir is telling you to make shortcut by your own, not by somebody who made. It will be a rapid revision for some other faculty who made that. I can finish surgery in 3 days, but for finishing that in 3 days, I have gathered contents for more than months together. I have prepared for 6 months to 1 year. I can understand that 3 days surgery, but you cannot understand in 3 days. You have to prepare your own content. So please don't rely upon these shortcut courses, capsule courses. All those courses will only spoil your method of preparation and will spoil your future ranking in PG examinations also. So please read Bailey and Love. There is no shortcut for reading Bailey. Line by line, if you read Bailey, you can make your own notes. As sir told, Addison is a very big book. You cannot read directly, but you can make notes and you can read Addison. But Bailey is easy. You can read Bailey. You can make small notes of Bailey. You can release one short Bailey by yourself. Don't make sure. Don't.
I think Rajamahendran sir, the time you were doing MBBS, yes. I know many of I've heard from many. You have actually prepared notes of your own.
Yes, I used to prepare my own handwritten notes. I read only one time Bailey. All essential things I made it as a notes in Bailey. Same way I read for OG also. I read a notes and I used to read my OG notes. Because reading in book will be definitely difficult in the last minute. If you have your own notes, it will be very easy to revise in the last minute. So prepare notes. It will be very helpful. So don't depend on these capsule courses, rapid revision course and all. It will be just it's a marketing course to attract you to this platform. That's all. Okay.
And also I would like to add one point, sir, here.
Yes, ma'am.
So short courses will help you solve one-liners, but short courses will not help you solve clinical-based questions.
Correct,
to solve clinical questions, you need to have a knowledge in depth, sir. And as we are expecting the next pattern questions, more questions are going to be clinical. So here, short courses will not help, I think.
Yeah, right.
Correct, madam. Correct, madam.
So that is it, a summary of the final MBBS. But see, this was just a short 20-minute session.
Yes.
Where all our faculties have just conveyed to you in a concise form what should be done. But the discussion doesn't stop here. We are always available for you. Sandeep sir is active in the social media. He has his Instagram page. He has his own YouTube channel. And Rajamahendran sir has also a very active YouTube channel. Vidhya ma'am has a Telegram group. So I have a Telegram group. I am available in Insta. I have a YouTube channel. You can be in touch with us. And if you have any further queries as well, please do post in the comment section of this video. Even later, we'll be happy to answer.
We will do another session soon, sir, after one month, because only then the final years are actively coming. We will do one session after 1 or 2 months.
Excellent. So we all will be there. I think, I can guarantee one thing as a platform, we'll not just record some lectures, give you and then go away. We'll be there to guide you as well. And all the content in the Doc Tutorials app will be updated content based on the guidelines as well, because all of us are practicing as well. Like all 4 of us are practicing. So what we are teaching will not be from, we read some textbook and then teach you. You watch a 20-minute video from Rajamahendran sir or Sandeep sir. That 20 minutes is just not a synopsis of a particular textbook. The years of experience they have, the number of cases they have seen, they have learned from their teachers. I think that is what will, you can listen in the 20 minutes. So that 20 minutes of video of a topic is many, many months and years of hard work, persistence, observation that we all have had. And that's it. Thank you all students for joining, and thank you to all the faculties and all the students. When you go to final year, I tell you one thing: enjoy your final year. This is a wonderful time that you're going to have, along with internship as well. But many seniors might tell you that so much to learn, but I think if you learn in the proper way, like we have advised you, you're likely to perform better. Thank you, everyone. Bye-bye.
Thank you, sir. Thank you. Thank you, sir. Thank you for the opportunity. Thank you so much, sir. Thank you, sir.